You've made the decision, or maybe you're still on the edge, but you feel it, don't you? That pull towards something different, that knowing deep in your chest that birth doesn't belong in a fluorescent room filled with wires and whispers behind clipboards. You want your birth to be yours, intimate, unrushed, powerful. You want to feel safe and supported, not monitored and managed. So let's talk about exactly what you need for a home birth, not just the checklist, but the real foundation, the people, the energy, the tools, and the truth. Because this isn't about being brave or trendy, it's about reclaiming what was always yours. First, you need a midwife, and not just any midwife, but one who sees you as more than a chart. You want someone who doesn't flinch at your questions, who makes you feel more powerful every time you speak. Certified professional midwife, licensed midwife, CNM titles matter, but presence matters more. Your midwife will guide you through every step. Prenatal visits that actually take time, evidence-based care rooted in respect and real trust in your body's ability. She won't be a stranger who walks in when you're 10 centimeters, she'll know you. She'll see you. This isn't just a medical provider, it's a relationship. If that doesn't feel right, not the right midwife. Now, let's talk about the doula. Because even if you have a midwife, you still deserve someone whose only job is to support you emotionally, physically, and spiritually through labor. A doula isn't there to monitor or check your progress. She's there to hold your hand, remind you of your power, breathe with you, squeeze your hips when the waves hit, and look into your eyes when you forget how strong you are. Doula support your partner too. They anchor the room in calm. They advocate through presence. They remember what matters when you forget. Midwives watch your body. Doulas watch your soul. That's the difference. And yes, your partner matters too, whether it's your husband, your wife, your sister, your mom, whoever is standing beside you, they are part of your birth team. But listen closely. Their job isn't to fix or control, it's to hold space. They don't have to be perfect. They just have to be present. Support can look like rubbing your back or sitting silently beside you with tears in their eyes. If your partner is unsure, nervous, or doesn't understand home birth yet, that's okay. Invite them into the process early. Let them meet the midwife. Let them ask the questions. Let them grow with you. Birth can transform them too. Now let's get into the practical. The supplies and the space you'll need to create a birth environment that feels safe, warm, and sacred. This isn't about fancy gadgets or expensive gear. It's about creating a container where your body can do exactly what it was made to do without distractions or pressure. A clean, soft, calm space, whether that's your bedroom, living room, or bathroom, is your foundation. You'll want a thick, waterproof mattress protector or several absorbent pads on the bed or floor, because when your water breaks or your baby arrives, things will get messy. You'll want plenty of towels, soft, old, and ready to be thrown away after. A birthing pool is not required, but can be a game changer for pain relief and relaxation. So if you choose one, make sure it's the right size for your space and easy to fill and empty. Simple things like a spray bottle of water, some gentle massage oil, and maybe a few essential oils like lavender for calm or clary sage to encourage contractions can transform the atmosphere. Your midwife will bring most medical supplies, but you can prepare a birth kit with clean scissors, clamps, and sterile gloves if you want to feel extra ready. And here's something many don't talk about enough: your emotional readiness. Having the right people and the right space is one thing, but being mentally and spiritually prepared to surrender control, to trust your body, to allow the unknown to unfold, that is a whole different level of preparation. This can mean prenatal yoga or meditation, reading birth stories, listening to affirmations, or spending quiet time visualizing your labor. It means making peace with the fact that birth is unpredictable, but knowing you have a team who will support every twist and turn. You might want to create a playlist of music that calms you or energizes you. You might want to practice breathing techniques or talk openly about fears and hopes with your midwife or doula. The space you hold in your mind matters just as much as the space you prepare in your home. Finally, postpartum support. The birth is just the beginning. You'll want soft clothes, nursing bras, a comfortable place to rest, and plenty of nourishing food. Your midwife or doula might bring placenta capsules or suggest herbal remedies for healing. And don't underestimate the power of community. Friends or family who can bring meals, hold the baby while you nap, or simply check in without judgment. Preparing your home birth means preparing for the days after the baby arrives as much as the birth itself.